Hi, I'm Alistair from Lazarus Training, and in this video we're going to look at some updates to our CPR protocols brought about by the COVID-19 coronavirus. Cardiopulmonary resuscitation, otherwise known as CPR, is part of virtually every first aid course, and that's with good reason. It's part of what we call the chain of survival. If someone goes unconscious and stops breathing properly, goes into what we call cardiac arrest, then CPR is a vital part of the routine that's required for the person to survive. Its aim really is to buy time for better help to arrive, particularly the use of a defibrillator. Now, there's always been a risk in CPR of cross-contamination between the rescuer and the patient and the rescuer, and we might think of blood, bodily fluids, TB. And that's why on many first aid courses people are taught to use these type of things, face shields, pocket masks and so on, as a barrier method of protection between you and the patient. However, with COVID-19 coronavirus on our minds, a number of organisations have come out with some new updated guidelines. What I'm going to show you now are some guidelines that have come from the International Liaison Committee on Resuscitation, the European Resuscitation Council and the UK Resuscitation Council. So the changes to the guidelines that have been recommended all centre around the idea that the person could be breathing out droplets which could expose you to COVID-19. Now this really brings up a couple of areas of risk. One is when we assess the person for breathing, and one is whilst we're actually performing CPR. So let's look at each of those in turn. Checking for breathing. A lot of people, when they do first aid training, are taught to check for breathing by putting their face down close towards the casualty's face. And this would bring you in very close proximity to their mouth and nose where potentially droplets could be coming out. So we need to have a slightly different approach to checking for breathing. Now if someone has stopped breathing, clearly they're going to look very unwell, they're going to look lifeless, look dead, etc. But one way that we can check for breathing is by putting our hand onto the person's abdomen. If we put it into the upper part of their abdomen, just underneath where the ribs finish, what we will see is as the big muscle called the diaphragm moves up and down as they're breathing, this area rises and falls. And if we've rested our hand on there gently, it should rise and fall with their breaths. Now Dave isn't a real person, so there's no movement, but we'd expect to see a rise and a fall as the person breathes in and breathes out. So with the COVID-19 virus concerns, well, the current recommendation is that on adult casualties, we stop doing mouth-to-mouth, the kiss of life, artificial ventilation, whatever you want to call it, and we concentrate instead on what's called compression-only CPR, just doing the pumps on the chest. Now, it's believed this is the main part of CPR at the moment anyway, and it's been around for a while in case you were unable or unwilling to do mouth-to-mouth, so we know that this is a successful technique. So, how do we do this? Well, it's the same part of CPR as you've probably been taught before, but there is one other bit we need to mention. When we're jumping up and down on the person's chest, this could cause air movement through the person's airway into their mouth and nose, and therefore this could lead to a risk of those droplets coming out. So the face shield that we mentioned earlier, the recommendation is we use something like a face shield and we put it over the person's mouth to act as a barrier, so if any droplets do start to come out, they're stopped by that face shield. Now I can get on with my compressions. I open up the clothing and I'm looking for the centre of the chest. I'm going to use the heel of my palm as the main bit that I put pressure on with, and that sits in the centre of the chest. We don't measure it out too much, but I'm roughly on a line between the armpits where it crosses the breastbone. I put my other hand on top and I link my fingers so that they won't slip anywhere. I straighten my arms if I'm able to do so, and I bring my shoulders forward so that they're above my hands. And the idea is now I can use my body weight through my straight arms to squash the person's chest, then release them. Now that would be one compression. We're aiming to squash them about 1/3 of the size of their chest. If you think about it from where my hands are to the ground, I want to squash about 1/3 of that distance. Now we don't do one compression or two compressions, we do loads of them. And in some first aid guidelines we've taught people to do certain numbers. That's not relevant here in chest compression only CPR, we just keep going. The speed is meant to be about 100 to 120 per minute, so that's a little under 2 a second. And this is where you've heard of Vinnie Jones and the music Staying Alive and so on. So let's see that in action. So we're not worrying about counting them, we're just doing them and trying to keep that good speed going. This is clearly going to be very tiring, and I will need to swap with somebody quite soon. So in this video, we've been looking at some updates to our CPR protocols due to the COVID-19 coronavirus. These updates are valid for adult patients, because with adults it's believed that the compressions are the main part of CPR. The balance of risk means it's acceptable for us to do compression only CPR. However, with children, with babies and infants, their need is much more based on the oxygen side of things, and therefore the recommendation is that if you have to do CPR to a child, baby or infant, you still put your ventilations, you still put your mouth to mouth in there in the routine that you've probably been taught already. I hope you're enjoying the content that we're putting out onto YouTube. If you do, please give us a thumbs up. That's always really great to get that kind of warm feeling inside to know that you're enjoying our content. I'd also urge you to subscribe, because that opens up some more options for us about things that we can do with the channel. And then finally, notifications. Every Wednesday evening, 6 PM UK time, there'll be a new video going out. And therefore, if you hit the notification button, you're never going to miss it. Speaking of the new videos, we have a plan of what we're going to be covering week by week, but if there's a first aid topic you'd particularly like us to cover, we'll drop us a message or put it in a comment below and we'll see what we can do. It may well be on the list already, but why not let us know what you'd like to see. So, until next time, bye.